Hi, my name is Evan. I'm a psychiatric mental health nurse practitioner student. Thank you both for being here today. Before we begin, I just want you to know that this is a safe space. My goal is to learn more about Brennan's experiences so that I can help support both of you. I just want you to know that this interview will be recorded. The recording will only be used for educational purposes and will only be seen by my instructors and my classmates. It won't be shared outside of that and will be kept confidential. Do I have your permission to record today's session?
Yes.
Are you okay if we record today, buddy?
Yes.
All right, great, thank you. Let's get started. Brennan, can you tell me a little bit what brings you in today?
I need to refill my medicine.
Okay. All right, Mom, what brings y'all in today?
He's out of his medicine, so we need his medicine right now.
And what does he take medicine for?
For his ADHD.
And what medicine is he taking?
Quilichi, 40 milligrams, once a day.
And it seems to be working well.
It does work well.
All right. Can you tell me a little bit about Brennan and when he first was diagnosed? Like, what made y'all think that there was an issue to get him tested?
He was in first grade, so it was about 3 years ago, and he was having trouble concentrating at school, doing work, and wouldn't ask for help, and then his tests started coming back, and then he would start, and his test would be good, and then it would be blank on the back, and he was making bad grades, so we took him to his pediatrician. She has to do some tests with the teacher and ourselves, fill out some paperwork, and it showed that he had ADHD, so she put him on medicine, and we've been taking medicine ever since.
During that time when the teacher kind of had brought that to your attention that things weren't going well in school before you had him tested, were there ever like any behavioral issues that he had?
I mean, he was full of energy, but not any more than normal average boy. But
Okay. So he never got in trouble for like any anger outbursts or for being like defiant or being like just like flat out refusing to do anything.
no.
So mainly it was just like his inability to focus and like stay on task and just kind of being a little fidgety, a little bit maybe up and down,
Yeah.
and then just not completing the work. Okay. So he takes his medicine first thing in the morning,
Yes.
and then since taking the medicine, do you and the teachers both feel like that it has improved his symptoms?
We do. I feel like it's helped a lot. He's able to not have to be removed from the class and be able to function in the class with other students without being.
Okay, and then what about like in the afternoons? How does homework go now with medicines?
He's able to complete it in a timely manner.
Okay. Are there like even with the medicine now, are there like any concerns about like mood or aggression, or like maybe like his mood being like labile, like he goes from one extreme to the other?
No.
And then what about his appetite? How's it? You know, sometimes these medicines they kind of suppress their appetites, but how's his been, and how about his weight gain? Like, is he maintaining?
He maintains his weight. He gains a little bit at a time, but I mean, he eats breakfast and then he normally skips lunch, but then he eats a first supper and a second supper, so
Okay.
it all balances out.
And then, you know, these medicines also are real bad about messing with some kids' sleep. How does he sleep?
He sleeps well. He sleeps 8 to 10 hours a night.
Okay. All right. And then, so we're gonna move on now. We're gonna talk about like some of his like past psychiatric history, if he has any. So other than ADHD, was he ever evaluated or treated for anything like oppositional defiant disorder? Ever said he had like a conduct disorder or anything like that?
No.
Okay. Has he ever had any psychiatric hospitalization for anything?
No.
Has he ever done like an outpatient treatment program for anything?
No.
And then has he ever, even for the ADHD, done any type of therapy?
No.
Has the pediatrician ever recommended therapy for him?
No, they have not. We asked, and we were sent to a Marsha Stapleton, but she just wanted to change his medicine. So
Okay. So besides the Coolichu that he's now on, what other medicines has he been on for ADHD in the past?
Concerta, Adderall, Vyvanse.
Okay. And like, why? What was the issue with those medications? Like, why was there like so many swaps of
He
medicines?
had side effects with all of them, like bad headaches, nausea, stomach pain.
Okay. And like, did any of them cause like have a change like in his mood or anything like that?
Yes, I can't remember which one they did. It did make him very zoned out and very quiet and not himself.
All right. But no issues with the since being on the Coolichu, like it's not caused any of those symptoms or had any side effects or anything like that done.
No, Coolish works well for us.
Okay. And then has he ever had any type of genetic testing done?
No.
Okay. And then what about any like suicidal or homicidal ideations that you're aware of that he's expressed to you or to anyone? No.
No.
Okay. We'll move on to his past like medical history now. Other than ADHD, has he ever been diagnosed with anything like medical?
No.
Okay. And then has he ever had any recent illnesses? Has he been sick recently with anything from like a cold to like flu, strep, anything like that?
No, not recently.
Okay. Has he ever had any like medical hospitalizations?
No.
Has he ever?
Or,
Ever.
Oh yes, he has been hospitalized for medical reasons.
Okay, what was he hospitalized for?
Like the flu one time, RSV when he was a baby.
Okay. But other than that, he's been healthy and
Yeah.
okay. What about any head injuries or any loss of consciousness that you're aware of?
No.
Any seizures?
No.
Any like cardiac complaint, like chest pain, palpitations, fainting, anything like that?
No.
All right. And then what about any surgeries?
Yes, he's had his tonsils and adenoids removed, and he's had tubes in his ears twice.
Okay. And when did he have his tonsils and adenoids removed?
2020,
And then and when did he have his PE tubes placed?
2017, and 2020.
Okay. All right. And then what? We'll move on to like medications and allergies. So like what besides the Coolichu, is he on any currently prescribed medications?
No.
And then does he take any over-the-counter medications daily for anything, or like even just sometimes?
Zyrtec, probiotic.
And is he allergic to any medicines that you're aware of?
No.
All right. So now we're gonna move on to like his developmental history. We're gonna ask some questions about kind of how, if there were any issues along the way. So during your pregnancy, did you ever have any issues, or like was he exposed to any substances or toxins that you're aware of?
No. I mean, I had preeclampsia, but other than that, no toxins.
Okay. And then his delivery, was he full term? Was he preterm?
He's preterm.
How many weeks?
36 weeks and 4 days.
And then was he was it a vaginal birth or was it done via cesarean section?
It was vaginal.
Were there any complications or any of that? Anything like that?
No.
Nothing wrong with his cord?
He did have a true knot.
Okay. And then what about like after he was born, did he have any like complications that required like a NICU stay or anything like that?
No.
And then what about his developmental milestones? Did he have any issues? Did he achieve everything on time? Was there anything that you were ever worried about?
No, he made all of his milestones.
Okay. And then how would you describe like his temperament?
Regular, full of energy boy.
Okay. All right. We'll move on to his education history. So did he have like getting like early childhood intervention or anything like that for anything?
No.
And then what about like if he went to daycare? Did daycare or preschool teachers notice anything about him that they thought like that they were concerned about anything?
Not that I was ever notified.
Okay. And then so he's currently in what grade?
Third.
Okay, and he's just in a regular classroom.
Yes.
Does he have any like special education program, IEP, or 504 plan in place?
No, he's at a private school, and those aren't available at the private school.
Okay. Do they have like really like do they have like small classrooms where they can work with him like closer if they need to?
Yes, in very small classrooms.
All right. And he goes like his attendance. How is that?
He goes every day.
All right. And then how would you say he does academically, especially now being on the medicines?
His grades are a lot better now that he's on the medicine.
Okay. Does he ever struggle with one subject over another?
He did struggle with reading, and but we did Sylvan, and that helped a lot.
Okay.
And he does better in math.
Okay. And then what about his behavior? How does the teachers usually describe like his behavior during school?
So he's well behaved, that they have no issues with him.
Okay. And then what about like his social interactions? Like, do you know does he have friends? Does he make friends easily at school?
Yeah, he does make friends easily. He has a lot of friends.
Do you feel like you have a good many friends at school, Brennan?
Mhm.
Okay. And you like to play with them at school?
Mhm.
All right. Do you feel like you can make friends pretty easily there at your school?
Mhm.
All right. All right, Mom. We're going to talk about family medical history. So this will be like father, mother, and then just his grandparents. So any psychiatric family history, these include things like ADHD, anxiety, depression, bipolar, schizophrenia, anything that would encompass that psychiatric realm.
Yes, my mother has bipolar and paranoid schizophrenia.
Okay. Anyone else?
No.
Okay.
Oh, his dad does have ADHD, I'm sorry.
Okay. No, that's okay. And then what about like medical family history? Kind of the same people, father, mother, siblings, and then maternal and paternal grandparents.
I have intracranial hypertension. His dad has high blood pressure. His sister has agenesis of the corpus callosum. My mother has high blood pressure and heart disease and diabetes. And then my father has high blood pressure and glaucoma. And then I'm not sure about my husband, so.
Okay. And then what about any family history of genetic disorders, seizure disorders, or sudden cardiac death?
No.
So we're gonna talk about like his social history, kind of like living situation, things like that. Brennan, who do you live with at home?
My parents.
Do you have any siblings?
Yes.
Do you have a brother or sister?
Sister.
Okay. And is she older or younger than you are?
Younger.
All right. So you and your husband are still married,
Yes.
live in the same household. Okay.
Mhm.
Any additional caretakers that y'all use, like outside the home?
No.
Right. And how do you feel like y'all's relationship, you and your husband's relationship is with Brennan? Like, do y'all feel like y'all have a good relationship? Feel like y'all are, like have a supportive relationship with him and everything that he needs?
Yeah, we have a good relationship.
Okay. And both you and your husband are employed.
Yes.
And so we said just one sibling, just a sister. But do they get along well?
Yes, I do.
Do they ever they do a lot of fighting? Is it like really bad?
Not a lot of fighting. I mean, they have their quarrels sometimes, but not frequently.
Okay. And then Brennan, like, what do you like to do with like your family?
Play games.
Okay. And then your friends at school, what do you like to do with them?
I like to play kickball and play soccer.
Okay. And then outside of school and like at home or like during the summer, what are some things you like to do for fun?
Swim.
Okay. Is there anything else you like to do for fun?
Like the water park.
Okay. Do you play any sports?
Yes.
What sports do you like to play?
Baseball.
Okay.
Basketball.
All right. You pretty good at those? Okay. And then what about like, do you have like any favorite like animals, or
Snakes.
you like snakes? Okay. All right, Mom. So the last part's going to be a risk assessment. We're just trying to determine like if he feels safe, or, you know, any types of abuse. Is you're aware of? Has he ever had any type of abuse reported to you that you're aware of? Okay. Brennan, do you feel safe at home and at school?
Yes.
All right. And then lastly, you know, has he ever had any signs of like aggression towards anyone, whether it be a sibling or a random stranger or people at school or anything like that?
No.
Okay. All right. Well, that's all the questions that I have. I thank you both for participating and answering everything that I had, and we will get his stuff taken care of. Okay.
Alright, thank you, appreciate it.
Thank you.